This clinic in Western Japan has been helping cancer patients with a new type of treatment. It attacks cancerous growths through the blood vessels.
堀先生、こんにちは。よろしくお願いいたします。こんにちは。お世話になります。So what actually happens in this room?
This is where we perform the procedure. We treat patients' cancer through their blood vessels. We look at three-dimensional images like this and insert a catheter into patients' blood vessels to treat them.
The procedure is called arterial embolization. Cancerous tumors encourage the growth of blood vessels to provide them with nutrients and oxygen. Hori developed the new treatment by focusing on these blood vessels. Doctors insert a catheter from the patient's groin through an artery all the way to the cancerous tumor. Then, they inject cancer drugs through the catheter directly into the affected area. They also inject something called an embolization substance to block blood vessels around the cancer. This stops the blood flow, so the cancer can't get the nutrients and oxygen it needs to keep growing. The treatment attacks cancer on two fronts, through cancer drugs and embolization, to weaken and shrink malignant tumors.
Good morning. Are you ready?
Today, the team will perform the procedure on a patient with liver cancer. These are images of the patient's liver. The tumor is quite large, occupying some 60% of the organ in terms of volume. Because of its size, neither surgery nor radiation are possible, and conventional chemotherapy hasn't been effective. To block blood vessels, the doctor uses a thin catheter like this one. It has a diameter of 1 millimeter and is softer than typical catheters. It takes delicate skill to insert it through the groin and guide it into the affected area. This shows the catheter inserted into the patient's blood vessel, with the tip making its way toward the tumor. The doctor first injects cancer drugs through the catheter, followed by the embolization substance. This method requires only about 20% of the medication used in conventional therapies, because the drugs are sent directly to the cancerous area. Lower dosages reduce side effects. This patient's procedure was completed in about an hour. She had an incision of just 1 millimeter and was discharged the next day. We spoke with one of the clinic's patients who has seen a dramatic turnaround thanks to the treatment. Chigusa Nakai is now 49. She was diagnosed with breast cancer 9 years ago and underwent surgery. But 3 years later, the cancer was found to have spread to her liver. Nakai was told it was terminal. She underwent treatment with chemotherapy, but this year, doctors discovered that her tumors had begun growing rapidly. Blood tests showed her tumor marker reading was more than 3,400 times the normal value. Her doctor said she had just 6 months to live.
My doctor said, let's think about the worst-case scenario. My husband and I thought, my illness had reached that stage. By worst-case scenario, we assumed the doctor meant I would die. I wrote down my final wishes, including what I was thinking, like things I wanted my children to know.
Her tumors eventually became too big to operate on. Doctors determined that radiation or chemotherapy would have little impact, so Nakai decided to pin her hopes on arterial embolization. About 2 months after the procedure, the tumors in her liver had shrunk significantly. Her doctor said her life was no longer at risk.
I was like, it's so wonderful. I couldn't help crying. My daughter is turning 20 next year, so she'll attend a coming-of-age ceremony. She says she wants to borrow my kimono for that. So I'm working hard and looking forward to taking pictures of her in my kimono. I cherish every day, and I couldn't be more grateful that I continue to live each day to the fullest.
What actually is embolization itself?
Embolization means stopping the flow of blood in arteries. We have arteries running throughout our bodies. But cancerous tissue requires more blood vessels than normal tissue does. So there are many blood vessels around cancerous growths. What we do is bring a microcatheter as close as we can. When possible, we insert it into the cancer itself, so we can block just the blood vessels connected to it. We temporarily block the blood vessels feeding the cancer, without damaging normal tissue. The procedure is advancing every year as new technology becomes available.
Arterial embolization was originally developed for treating liver cancer. The liver mainly receives nutrients through the portal vein and oxygen through the hepatic artery. But when cancer cells form, only the hepatic artery feeds them. When embolization blocks the artery, the liver still receives nutrients and enough oxygen through the portal vein so it doesn't die. But it used to be difficult to perform the same procedure on cancer in other organs. The breast, for instance, relies on arteries for both nutrients and oxygen. If blocked, nutrients and oxygen can't reach the breast. That would kill cancerous cells, but it could also cause normal tissue to die. To successfully treat breast cancer with arterial embolization, the catheter needs to reach tiny blood vessels close to the affected area.
Blood vessels connected to cancerous tumors are just 1 or 2 millimeters in diameter. They're very thin. It's important to be able to insert a catheter safely into them. If a blood vessel collapses or tears during catheter insertion, emergency surgery is required. To avoid that, the medical devices must be safe.
Hori set out to make improvements so embolization could be used on organs besides the liver. After 10 years of research, he and a medical equipment maker succeeded in developing a new microcatheter.
So Dr. Hori, what is it actually made from, the actual catheter itself?
It's made of a special kind of plastic with a very, very thin braided metal wire embedded inside. It looks like a simple tube, but it's the product of advanced technology. It doesn't sever easily, but it's flexible, and it's visible in X-ray images. It moves just the way you want it to. It's like an ultimate high-tech product. This catheter can go anywhere inside blood vessels.
Well, it looks like it's alive. I mean, it looks like it's a worm moving. It's incredibly realistic.
Hori has also developed an embolization substance for administering the treatment through very thin blood vessels. By shrinking the size of the particles in the substance, he's made it possible to embolize blood vessels measuring just 0.1 millimeter in diameter. Thanks to his work, arterial embolization can now be performed on cancerous tumors of the lungs, breast, uterus, and bladder. Hori's method is also drawing attention outside Japan. Doctors from around Europe and Asia visit Hori to see how it's done.
In Taiwan, arterial embolization is performed only on the liver, but this hospital uses it on other organs. I'm learning a lot. Once I return to Taiwan, I'd like to try using the therapy for a variety of cases and work to produce results just like Dr. Hori. Arterial embolization doesn't cost much, whereas chemotherapy is very expensive. Surgery costs a lot of money too, and we can only operate on so many patients. Radiation therapy also has its limits. Countries with large populations need an economical, reasonably priced treatment method that is also effective. People in many places around the world are very interested in how they can ensure effective treatment. I'd say doctors from abroad are keen to learn and improve their skills.
And Dr. Hori, have you compared, for example, what are the rates of recurrence of cancer with this, after this treatment? Does it differ greatly from, for example, chemotherapy and radiation in terms of, for example, metastasis after this treatment?
Arterial embolization works well on some tumors, such as a certain kind of lung cancer. People with tumors like that may see their cancer more or less disappear after a single treatment. But results differ from patient to patient, depending on the characteristics or location of their cancer. Generally speaking, though, tumors become much smaller 1 month after the first treatment. If the tumor shrinks, and if there are no problems, we just wait and see. But if there's a problem, then we perform the procedure again and try to shrink it further. Many of the patients we're treating now are not necessarily looking to get rid of their cancer completely. They underwent standard therapy, but their cancer came back, and none of the usual methods can treat them. But if we can shrink their tumors, they can live longer. For such patients, we think about how we can help them live longer and comfortably. That's not the same as removing cancer. To make it so that cancer doesn't kill people or cause them to feel pain, that, we believe, is true health care. We keep that in mind as we treat our patients.
Thank you so much for your time today, Dr. Hori. It was such an inspiration. Thank you so much.
Thank you.